wanting to inject the tail of the corrugator, but you somehow ended up going a little bit too deep. Have you ever had ptosis, or as a provider caused ptosis with Botox? I was watching a video on Instagram of an injector that was placing injection points above the eyebrow. In the comments, it seemed that there were a lot of concerns about that area because of the risk of an eyelid ptosis. So I wanted to help educate what I learned, which was the safest practice technique. Although it depends on the anatomy of the person, because sometimes it can be unpreventable, but there is a safer technique out there to help hopefully prevent ptosis. And let me show you how. Hi, my name is Miranda. I'm an aesthetic nurse practitioner, and I'm here to show you what you could do to help prevent an eyelid ptosis. Okay, so what I'm going to show you is what I've been seeing lately when I'm watching these videos of other aesthetic providers. And I'm not saying that they're doing it wrong, but it does increase the risk of causing ptosis. A lot of the times I see, we have the head of the corrugator here. You're supposed to do a deep injection, in the head of the corrugator. And then there's the tail. The muscle of these corrugators run kind of like this. We are injecting in the head deep here, where you see the activation of that muscle. And then for the tail, it's a high risk area to be injecting here above the mid-pupillary area. There is a muscle that runs in the middle of your eyelid, which helps contract your eyelid to go up and down. So providers are injecting here. I noticed that they are going in at a shallow depth, but at this angle. To reduce the risk of causing a lid ptosis, it is best practiced to inject at a lateral angle, staying superficial, right above where into the tail of the corrugators. This will help reduce the risk of causing ptosis.